can see right there the cancer had already spread. By the time it reached her brain, limited our options.
But there are options, right? Look, I know she's going to die, but she doesn't have to die right now.
Her health has been so compromised that any surgery is a risk. Neurosurgery even more so. This procedure is complicated and costly.
I know one neurosurgeon who's capable of pulling off a procedure like this one. If only he weren't on suspension.
If anyone can remove the cancer from Shirley's brain, it's Patrick. Stephen, you have to lift his suspension.
Patrick's suspension isn't the problem. The surgery is experimental. And since the patient's already been diagnosed as terminal, it's not covered by insurance.
Well, maybe Patrick will do it pro bono.
No, I can't ask a surgical team to work for free on a patient whose chances of survival are so small. I'm not even sure the patient would want that.
She does. She does. I already spoke to her. She's determined to maintain her quality of life for however long she has left. And you know, cancer of the brain can't destroy that.
You should have asked me first. We have no discretionary funds for a surgery this radical. I'm not going to get the board to fund that, especially on a terminal patient.
So you're not even going to try?
Paging Dr. Katie Grossbart. Paging Dr. Katie Grossbart.
We'll make sure Shirley is as comfortable as possible. I'm sorry.
You're still speaking to me?
Why wouldn't I be?
Oh, you know me, open mouth, insert foot. I know I've overstepped the dying woman's privileges. Who the hell am I to tell you to stop carrying a torch for your ex?
I always welcome your honesty and your advice, even if I don't follow it.
I'm just saying you deserve to be happy.
It's bad time?
We were just talking about you.
Shirley?
I brought you a gift. I hope you like it.
A gift? Oh, Lord, now I know I'm dying.
I thought that might bring you some inspiration.
Oh, Nikolas. This is absolutely beautiful. I don't understand why a young, attractive man like you would waste his time on an old broad like me. Or maybe I do.
Can I speak to you for a moment?
Sure.
Don't mind me. I have a book to read.
Definitely fond of that woman.
I know. She's wonderful. And that's why I wanted you to know her condition is deteriorating. The cancer has gone to her brain.
What can I do for her?
There's surgery, but it's risky and incredibly expensive, and her insurance won't cover it.
Of course. But it can help her.
If she survives the surgery, it could extend her life. Without it, she doesn't have long to live.
Well, what do you think?
I'm not really ready to see my friend die. And I truly believe that it'll allow her to spend her remaining days with dignity. It's a shame it comes down to dollars and cents.
So it's only a question of money?
I realize I have no right to ask you for anything.
Of course. I'll cover Shirley's medical expenses.
Nicholas.
I'll go make the arrangements right now.
I don't know how to thank you.
You don't have to. It's just nice to know that you still feel like you can turn to me.
So I punched the chief of staff. I was out of line. I copped that. Why am I here?
Shirley Smith's cancer has spread to her brain.
Lisa volunteered you for the surgery. Actually, her exact words were, "You're the only one who can pull this off."
It's very tricky.
Nikolas has offered to cover the medical expenses.
That's very generous of him.
So what do you think?
I think we don't have a minute to waste. Scrub up, Dr. Niles.
I'm learning a lot about you, Dr. Drake.
Well, I'm sorry about that.
You should be. You've got quite a reputation. In addition to a mean Roomba.
Oh, yes. Well, all of those rumors are true. But you couldn't find a better neurosurgeon.
I can already tell by his bedside manner and that sparkling smile.
Seriously? Because that's pretty much the last thing I've ever been known for is my bedside manner. I've always just skated by my handsome good looks.
And being humble.
Seriously, though, how do you feel about this?
Okay with dying. I've been preparing for a while. But I am not interested in drooling or going blind or being incapable of asking for a glass of water. So, if this operation will allow some quality time, grab a scalpel. I guess it all depends on the odds of success.
There are no guarantees.
I'm not asking for guarantees. I just want Dr. Dimples to tell me I'm not going to wake up as a rutabaga.
Well, I'm the best chance you have, sweetheart. Actually, I'm the only chance you have.
Got it.
Signed and sealed.
This is very generous of you.
It's my pleasure. I've grown quite fond of Shirley.
It's definitely the most challenging part of my job, having to refuse treatment. The next challenge is to keep the hospital solvent so we can serve the greatest number of patients. You saved me from having to make that choice. I appreciate it.
You're welcome. I'm sure having any sort of gratitude towards me is difficult to swallow, considering my situation with Elizabeth is a sore point with you. Just as I take exception to you interfering in our personal lives, but I respect the job that you do here at the hospital. And we're all lucky to have you. See ya.
All right, how you feeling?
Well, I'm a little groggy. It reminds me of the 60s.
You behave yourself.
I just hope Dr. Dimples is as good with the scalpel as he is with the Roomba.
I'll be waiting for you in recovery. Okay, you're gonna be feeling drowsy any minute. What is... How did you...
I'm sneaky. Hold on to it for me. I'm going to want it back. Don't look so serious. It's only brain surgery.
Pick a nice string, because here we go.
I'm gonna be right here for you.
Elizabeth,
Yes.
I'm gonna need you to step out on this one.
What? No, I can be just as professional as I am with any other
I know
patients.
you can, but things have changed.
It's worse than you thought, isn't it? What are her chances?
Well, she's still got me.